nearly a quarter here in the U.S. Hospitals across the country feeling the crush. New York's Governor Andrew Cuomo now warns the state is just days away from running out of ventilators.
If a person comes in and needs a ventilator and you don't have a ventilator, the person dies.
New York City and Los Angeles now recommending people wear face coverings in public. The White House expected to release new CDC guidelines as health officials worry about new hotspots in Texas and Florida.
We cannot take it anymore.
Frontline fight. Doctors and nurses contracting the virus at an alarming rate. Healthcare workers making up 20% of COVID-19 patients in Ohio and Minnesota. How the dose of the virus you're exposed to may affect you.
Feeling the financial pain. Nearly 10 million Americans filing for unemployment in just the last 2 weeks.
My family, my boys, and my wife and kids, they're my number one concern.
Now millions facing the potential loss of health insurance. What you need to do right now. 3 ways to restructure your finances.
No longer stranded at sea. Those 2 ships with hundreds of sick passengers have finally docked in Florida, but some still quarantined on board. We're there live with the latest.
Race for a treatment. The doctor from that hit docuseries Pandemic now claiming he's made a hopeful discovery as researchers all over the world come together like never before to find a cure.
And heroes and hope. First responders and doctors cheering each other on, and the patient whose wife says he was knocking on death's door, surviving COVID-19. Reunited with his family for the first time in 23 days, now home from the hospital.
Live in Times Square, this is Good Morning America.
Good morning, America. We love seeing that on a Friday morning. We love seeing it so much. Let's see it again. Let's see that again. It's a beautiful reunion for that family. Their father recovering from COVID-19, and it had been 23 days since they'd all seen each other. So you know how much love was filled in that meeting. And we're happy. I'm happy Amy is here, joining me in the studio at the desk, and we're happy to see our man George, who is there at home. George, how are you, and how is the family, my friend?
Good morning, guys. I'm doing well. I'm the only one awake in the house right now, which is a good thing. Checked in on Allie a few hours ago, and she's doing well. Her temperature's under 100. Her oxygen is strong, and she was so boosted yesterday by all the well wishes that came in to her, and especially encouraged that so many people seem to appreciate getting the information she was able to give yesterday. So we're happy for that. The girls are doing great. They are chipping in so well. So things are going okay.
Oh, we're so happy to hear that. We continue to send our love to Allie and to your family. We first, though, want to get to those new headlines this morning. Coronavirus cases worldwide are now topping 1 million. And take a look at just how quickly it spread here in the U.S. This chart showing where we were just on March 20th. There were 19,000 cases here. Now there are close to 250,000 cases.
And of course, New York is still the hottest spot in the country right now. And Whit Johnson starts us off from the Javits Center in Manhattan, where they are about to start taking COVID-19 patients. Good morning, Whit.
George, good morning to you. The military is really stepping up in a new role here. The Javits Center was converted initially to act as an overflow hospital for patients without coronavirus. But President Trump approved Governor Cuomo's request to convert it once again, now taking on patients with COVID-19 as the number of cases in New York State increases dramatically.
This morning, America's growing pandemic is rapidly consuming precious supplies. New York Governor Andrew Cuomo warning the state could run out of life-saving ventilators in less than a week.
If a person comes in and needs a ventilator and you don't have a ventilator, the person dies. That's the blunt equation here. And right now we have a burn rate that would suggest we have about 6 days in the stockpile.
But the federal stockpile is nearly depleted, and California's governor says 170 ventilators sent from the federal government did not work. Companies now scrambling to make new ventilators or refurbish old ones, not sure if they'll be able to get enough to patients in time.
On to the next phase.
Overwhelmed hospitals taking unprecedented steps to save lives.
Wonderful. So she's still extubated and breathing easily, right? Wonderful.
This cardiac ICU at New York's Mount Sinai converting into a unit for COVID patients only.
I'd say one of the ups is we were able to transfer a patient off the unit.
The U.S. death toll climbing above 6,000. Overnight, New York City's mayor joining Los Angeles, the nation's two largest cities, advising residents to wear face coverings in public.
It could be a scarf. It could be something you create yourself at home. It could be a bandana. We don't want you to use the kinds of masks that our first responders need, that our healthcare workers need.
The White House is expected to release formal guidelines soon, but Dr. Deborah Birx of the Coronavirus Task Force saying masks are not a substitute for social distancing.
The most important thing is the social distancing and washing your hands. And we don't want people to get an artificial sense of protection because they're behind a mask.
Across America, health officials fear new hotspots could emerge in states like Texas and Florida, which were slow to mandate social distancing guidelines. In Georgia, Governor Brian Kemp struggled to explain what prompted him to wait until Wednesday.
Finding out that this virus is now transmitting before people see signs, well, we didn't know that until the last 24 hours. This is a game changer.
But doctors have warned for weeks that people without symptoms can spread the disease. The pandemic especially cruel to one family in Ohio, 3 members dying in just 3 days. Katie Garbrandt losing both of her grandparents and uncle, her stepfather now in the hospital.
Listen to what you're being told, take it seriously. We want to spare any family we can from the trauma that we're going through. We can't have a funeral the proper way. We can't grieve with our friends and our family. And it just makes everything 10 times worse and tougher.
Unimaginable loss, but also reason to hope. Amanda Pomachan's husband, Titu, leaving the hospital after nearly a month. The 44-year-old father of 3 who was on a ventilator surviving COVID-19, reuniting with his wife and daughters.
When I woke up, the only thing I saw was bad news. It was 5,000 people got this and 5,000 people died. So I'm glad I was able to give some hope to other people that there's some good stories out there.
An emotional reunion there. Meantime, back here in New York, there is an issue that is of growing concern because the Navy hospital ship Comfort so far has only been able to take on a limited number of patients. So here's what they plan to do now, that they've converted the Javits Center here. They will take on those COVID-19 patients at this facility, and they will then begin to move some of the overflow patients here to that ship for further treatment. Michael?
All right, thank you so much for that, Whit. And you talked about concern. Concern is also growing for doctors and nurses working tirelessly to help COVID-19 patients and contracting the virus themselves at an alarming rate. 140 employees at one hospital alone, the Brigham and Women's in Boston, testing positive. Matt Gutman has much more on that story this morning. Good morning, Matt.
Hey, good morning, Michael. Given their daily exposure, I suppose it's not surprising that healthcare workers are getting sick. But here's what's disturbing. Experts are now telling us that the viruses are like poison, and the higher the dose, the more fatal it can be. And so higher doses combined with poor protective gear are making for a dangerous combination.
Frontline health workers themselves are turning into patients at alarming rates, and it's being called an epidemic within an epidemic. 20% of COVID-positive patients in Ohio and Minnesota are healthcare workers. In Boston, over 700 healthcare workers testing positive. They are exposed to the virus more than anyone else.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament.
Experts say it's not just the frequency of exposure, but also that healthcare workers are exposed to larger doses of the virus as well.
When you get exposed to a virus, your immune system immediately starts mounting a response. At the same time, the virus starts spreading within the body. An outcome depends on which wins the race, viral spread or the immune response. When you start with a high dose of virus, it gives it a head start in the race.
Meaning the virus can overload the immune system of even the healthy. People like Frank Garbin.
And by then, his breathing was almost non-existent. And when their paramedics arrived, they tried to revive him for about 45 minutes.
Garbin wasn't just any COVID patient. The 60-year-old was an ER doctor, the first in the nation to die from COVID. His best friend, Deborah Lyons, on the phone when he passed.
And he also knew exactly when he got it. He knew it was those 4 shifts that he had to use the same mask. He knew it.
What do we want? PPE!
Shortages in protective gear triggering protests in California and Kansas City. Nate is a nurse in New Orleans.
What are the biggest shortages you're seeing on the day-to-day?
I think we're short gowns, obviously, the disposable isolation gowns, the N95 mask. We're using masks for 5 to 7 shifts generally.
Reusing the same masks over and over. Masks are stored in those brown paper bags on those racks. But even when they do have proper protective gear, medical professionals can fall ill.
I did everything right, and I still came up positive, so I'm not really sure what's going on there.
Yet still, doctors and nurses are turning up every day. And despite all of that danger, volunteers are now turning out in droves. In California, New York, Colorado, over 120,000 retirees or people in other areas of medicine have volunteered, despite all of that danger, to join the fight against COVID-19. Michael.
Yeah, all heroes on the front lines, Matt. Thank you so much for that. We're going to bring in Dr. Jennifer Aston, who's joining us now. And Doc, thank you for joining us this morning. And could you tell us about this viral dose? And do you believe that could be the reason that the healthcare workers are contracting the virus right at this point?
I mean, that's the leading theory, Michael. As we heard in the piece, there's something called a viral load, a viral inoculum. That's how much virus actually gets into someone's body, and that can be a factor with how sick they get. Also, obviously, it's the contact, it's the exposure. Doctors, nurses are intubating patients, they're putting in lines, IVs. You know, they're really up close for a prolonged period of time, and we know distance, length of time, viral load, all of those things can play a factor in how sick someone gets.
And in most coronavirus deaths, they're elderly people, underlying medical conditions, but we're also seeing some younger, healthy people die as well. Could it be that these victims have been exposed to high doses of the virus?
Well, that's one thing we're looking at. The other thing is this really vigorous immune reaction, this so-called cytokine storm, which typically younger people with a more robust immune system can experience. But again, we're going to be looking at this because more older healthcare workers are being asked to volunteer, so it's going to be a split kind of population.
All right, Doc, thank you so much for that. And I'm sure we'll talk to you later on in the show. Amy?
Michael, this crisis taking such a toll on so many families. Our new ABC News Ipsos poll finds 9 in 10 Americans now say their daily lives have been disrupted by the pandemic. And President Trump's approval rating for his handling of the crisis taking a hit. 47% now approve of the job he's doing. That's down from 55% just 2 weeks ago. This comes as we see those record unemployment numbers. In just 2 weeks, nearly 10 million people filing unemployment claims. Look at that chart. Rebecca has all the latest.
This morning, a soaring number of Americans out of work. A record 6.6 million people laid off last week alone. In just 2 weeks, nearly 10 million people in this country have filed new claims for unemployment insurance. A staggering figure, which doesn't even include the self-employed or undocumented workers, or the many Americans who've been trying to apply but can't, like Emily Tucker, who worked as a sales associate in San Antonio, Texas.
I just got an apartment, started a new job, and I was laid off because my business was not essential.
Emily has been trying to file for unemployment benefits for more than 2 weeks.
I can't even get in contact with somebody to speak with them. So I am stuck with bills to pay, mouths to feed, no job to provide me an income.
Growing unemployment numbers put an unprecedented strain on phone lines and websites dedicated to unemployment benefits. That rising joblessness adding another strain, the potential loss of health insurance for millions.
We have never experienced an economic crisis that has come on, this fast or this profoundly. And this is coming in the midst of not just an economic crisis, but a public health crisis as well, when people need their health insurance more than ever.
After losing her job as a cook in Las Vegas 2 weeks ago, Jacqueline Balian has been trying unsuccessfully to file for unemployment.
I'm running out of all my money.
which was not a whole lot to begin with. And now I'm being told by my insurance company that if I can't pay my premium, then I have to switch to Medicaid and lose all my benefits.
Across the country, in Houston, Texas, James Pennyway lost his job as a photographer and is battling cancer for the third time.
My family, my boys, and my wife and kids, they're my number one concern. And I just want to make sure that they are taken care of.
It is so tough, but if you've lost your job, you can continue your coverage through COBRA. That's expensive. There's also a 60-day window to apply for Obamacare at healthcare.gov, even if the president doesn't reopen enrollment there. And if you meet the income qualifications, George, you can also qualify for Medicaid. George?
Those options are so important. Okay, Rebecca, thanks very much. Now to new fallout for that Navy commander relieved of duty after sounding the alarm about a coronavirus outbreak on his aircraft carrier. At least 114 sailors on board the USS Theodore Roosevelt have tested positive. Members of Congress are now speaking out in support of the captain, demanding an investigation. And Martha Raddatz is tracking all the latest.
The letter that got Captain Brett Crozier fired was a plea to Navy leadership to get most of his nearly 5,000 sailors off the ship as soon as possible, given the rapid spread of coronavirus on board, saying, "We are not at war. Sailors do not need to die." On Wednesday, Navy leadership confirming sailors were getting off the ship rapidly and that there would be no retribution for Crozier's letter.
The fact that he wrote the letter up to his chain of command to express his concerns would absolutely not result in any type of retaliation.
But last night, all that changed. Crozier relieved of duty on the carrier. The Secretary of the Navy didn't accuse him of leaking the letter, but for failing to safeguard the information and showing poor judgment.
Relieving of him of command was in the best interest of the United States Navy and the nation in this time when the nation needs the Navy to be strong and confident in the face of adversity.
Crozier has had a stellar career in the Navy in his more than 30 years and was on track to be an admiral. This will effectively end his career.
Although the captain should have protected the letter better, his crew will appreciate that he sacrificed his career for their well-being.
Democrats on the House Armed Services Committee called Crozier's dismissal an overreaction, saying, while he clearly went outside the chain of command, quote, his dismissal at this critical moment is a destabilizing move that will likely put our service members at greater risk and jeopardize our fleet's readiness. But, Michael, the Navy is getting most of the crew off that ship, just as Crozier wanted.
As they should. Thank you so much for that, Martha. And tough times for so many out there, but we want you to take a look at this. A really special moment outside New York Presbyterian's Lower Manhattan Hospital. The FDNY taking a moment to applaud all the doctors, nurses, and healthcare workers who are risking their lives every day to help coronavirus patients. It shows gratitude from one group of heroes for another.
Wow, that is beautiful. I have chills from head to toe. We certainly appreciate everyone's service. A lot more ahead. The race to find a treatment for COVID-19. The doctor from Pandemic who now says he may be making a coronavirus breakthrough. But first, let's go to Rob.
Hi, Amy. We are tracking the nor'easter here, among other weather headlines. For now, though, let's go to your weekend forecast, sponsored by State Farm.
For now, we're all living a new normal. Businesses are closing. Living rooms are now offices and schools. Our world is suddenly different, but one thing stays the same. State Farm is there. To any of our customers currently facing financial burdens, call your State Farm agent because we're here to help make this new normal feel just a little more normal. Like a good neighbor, State Farm is there.
Well, it's going to be another windy day, but looking beautiful this morning, maybe to get out for a walk or a run. Temperatures in the 40s will climb back into the lower 60s later this afternoon, but it will be windy, and you'll also notice a little bit more cloud cover through the afternoon and especially through the evening. But again, it will be dry. And looking dry for the first weekend of April. Nice to get outdoors, maybe clean up the yard. 61 degrees on Saturday and into the mid-60s on Sunday. And then tracking temperatures in the 70s next week. I've got the 7-day coming up in a few.
Hey, Mom, if I could talk,
what would I tell you? I'd tell you I love our walks and jumping up to play. We do everything together, huh, Mom? I guess what I really want to say is thanks.